I'm just setting this up here. And I'm very happy to welcome Dr. Marie Maddie, who is a doctor in family medicine in Poulsbo, a Bainbridge Island resident, and practices right across the bridge at Pacifica Medicine. And Dr. Maddie has joined us before, and I asked if she would be willing to return. She and Andrea Chaimi both are in this practice, and they, as we talked about before we started recording, treat patients from birth to death and everywhere in between, and often have multi-generation. So I'm very happy to have you here to give us some information about COVID-19. And one of the things that, of course, is challenging about it is that, at least as far as we know, it seems to be affecting different generations a little differently. Can you say anything more about what we know about how COVID is affecting people, and whether we know a little more now than we did a couple of weeks ago?
Yes. Well, thank you, Reed. Hi, everybody. Nice to see you all. Now that I've got the tiled format, I can see everybody's faces when you speak. Hello. Yeah, so feel free to ask any questions. I'll speaking to what we know, I think we're constantly learning. It is something that the information keeps coming through, and we're learning more every day, every week about the disease, about how it's transmitted, how it manifests differently for different aged folks. We now understand that it's very much a disease of blood vessels. It has pulmonary manifestations as well as nervous system manifestations, and can be be expressed differently in different people. And the fact that young children under the age of 5 have such new blood vessels is one of the things that protect them, and why we see different responses and different disease expression for different folks. So I think that's one of the biggest things we've learned in the last month, and that's why we see people having blood clotting issues, stroke issues, things like that, is because of the way the disease manifests from those ACE2 receptors, if you've seen that in the news. Of course, the most worrisome and biggest is still the acute respiratory distress syndrome that we see, which is a primary lung type manifestation of the disease that leads people to needing oxygen and more respiratory support, and some people having needing the ventilators. So that's one of the big things. The other thing is, I think you probably saw in the last few days, the first medication has been approved to show decreasing mortality and morbidity for folks is a steroid like prednisone that most people are familiar with, but this one in particular is called dexamethasone, and has been used to show a decrease of mortality in 30% of people on ventilators, and I believe it was 20% for people not on ventilators, but requiring oxygen support, but no benefit for people that are able to kind of manage the illness on their own. So that's exciting. Whereas some of the other medications that had showed some initial promise, like chloroquine and hydroxychloroquine, have subsequently been removed from being FDA approved for emergency use with COVID-19. So we're making progress with finding new treatments, making progress in understanding how it is manifest and how it causes different diseases. We're also getting more exciting news in the area of vaccinations. There's a couple different vaccine trials going underway. Probably one of the biggest ones that we have the most data is the Oxford vaccine. And it's been tested in humans, and it looks like they think they're going to have it available in September for citizens in the United Kingdom and potentially in October here. The key thing that's unique about this vaccine, and really about understanding the way vaccines work, is some vaccines are developed to prevent infection and other ones are developed to prevent disease. So when you get a measles vaccine, you're preventing contracting the measles virus. It works to prevent you from becoming infected. Whereas if you get the tetanus whooping cough combination, that pertussis, it is to prevent the disease, the manifestation of the infection. So, and sometimes the vaccines, when they work that way, it's more of preventing severe illness. And the current one out of Oxford is designed to do that. So rather than preventing the infection with the coronavirus, it actually prevents the more severe disease. And while that's not a perfect vaccine, we know like the measles vaccine, the smallpox vaccine, those vaccines prevent the disease. We're not quite there yet with this particular virus. So they are working on doing different vaccine development. There's, over 100 different companies that are working on these different types of vaccines, and they're all targeting things differently. Ideally, we would get a really excellent vaccine that prevents the infection, but right now we'd be pretty satisfied with getting one that helps prevent the severity of the disease.
Yeah, that's a tremendous amount of progress in a very short period of time.
Yes, I agree. Absolutely.
So, so what is the status of the Oxford vaccine? It's promising. Is it? What happens now?
I would say it's very, very promising. Again, it's, promising in that it would help. What we're seeing and what's shown in the animal studies, particularly the monkeys it was administered to, is those monkeys, after receiving that vaccine and then being exposed to the virus, showed much less severe disease, particularly of the ARDS, the respiratory manifestations. So, that wasn't a huge number, and it wasn't in a human yet. They've administered it in over 100 people in humans, and we're waiting to see those results. It's very tricky because then you don't necessarily want to expose those people to the virus to prove the effectiveness, how efficacious the vaccine is. So, we're trying to rush something that usually takes years to collect data. That's the tricky part, but so far the data does look promising.
So one of the other things that that comes to mind is that we're obviously, even as we work to try to develop treatments and a vaccine, there's a lot of impetus to try to reopen activities, and
Yes.
we've seen that in our county. Have you seen a uptick in what we've sort of euphemistically called flu-like symptoms being reported to you in recent weeks?
Interestingly, we've seen more kind of gastrointestinal symptoms with people coming in with kind of nausea, diarrhea, some GI stuff. And then some people coming in a little bit more with some fevers. We get all kinds of viruses in a community, even with the stay-at-home order that we've had, and even with people still doing a lot of people still doing an excellent job of self, quarantining or isolating. We are seeing a little bit more of these viruses, different version that tend to come in spring. We have at our office have not seen any new coronavirus, but we have had in June alone, since we've moved into phase 2, which we've moved in right at the end of May on the 28th, we've had 17 cases in June, whereas we had 9 in all of May when we were really in strict lockdown. That would be all of Kitsap County, broken up, of course, by Bainbridge North, South, and Central. But so we're seeing an increase. We're still at the appropriate number that we need to be at to move to phase 3. And my understanding is that that application is in process to be submitted on the 19th, which is what would be allowed 3 weeks after going into phase 2. So it's expected that we will continue to see cases, and we're still looking like in Kitsap County, we're at the number to go into the next phase. Whether we get approved for that or not, we'll see. Things are changing. The cases we see now are most likely relative to Memorial Day weekend, and since the reopening, there's that delay of a couple weeks for the diagnosis to come through.
Right. It's still 14 days is basically the sort of quarantine date range that people are recommending if you're sort of self protecting to see if you got the virus from either family activity or participating in protests. There have been a lot of people doing that recently. Right? That's 14 days is still the guide.
Yeah. So 14 days, what we're looking at is that incubation period, the time it takes from an exposure to develop symptoms. The average is still thought to be about 5 days. So usually by 5 days, the majority of people have it, but it can take up to 2 weeks. And as we were talking about, depending on, who you were exposed to, the situation, it may be a little bit less than that, but right now it's still recommended to look at the 14-day window. And if you haven't developed any symptoms at that period, you can feel pretty confident. Still, the question of how do we test in that period is also complicated, because the test that we do, the nasal swab, is still only 70% accurate at capturing the disease. There haven't been any improvements in that particular test, and that depends on what we call the viral load, or the amount of virus that a person sheds. And that's where we get really confusing data, because some people will have a very low viral load and will not be shedding a ton of virus and wouldn't be very contagious. Whereas we have these super spreaders, where people that will have 1,000 times what we see often for other folks, and those people are the ones that are super spreaders, and can infect a larger number of people. So, and we don't know how to determine that. And when we do the test, we aren't actually testing viral load. We're just simply looking for the viral RNA. And I'll just make a segue to that, is when people see people testing positive later after recovery, you can still shed the virus, although it's dead, for what we think is maybe even a few weeks. It's been up to 40 days after being ill. But that viral shedding does not necessarily mean it's contagious. It can be dead virus. So that's a key caveat when you see those positives.
Okay, so there's a lot of uncertainty about this, and
Yeah.
obviously the other thing that we've heard about is the potential for basically being asymptomatic, for being infected, maybe even shedding virus and not knowing it.
Yeah, and I think that a lot of people are trying to move towards maybe the asymptomatic versus pre-symptomatic. And everybody, we've all known people. Some people get terribly symptomatic and can subjectively feel like, oh, they feel so sick. Other people, they got a little kind of allergy symptom, but they still have a symptom, but they may not think of it as a symptom. And I think that's the tricky thing, is really also educating people what these symptoms are and how there is such a wide range of the way it's expressed in folks.
So we're being advised, if we're trying to protect others, to get tested. As you say, it's not a perfect test, but it is something.
Yes.
So
Yes.
so we're being asked to contact our doctors to get referred for coronavirus testing. I imagine some of your patients are asking you for that assistance.
Yes. Yeah, we have people coming in requesting tests. It's tricky because of that test, and if you don't have symptoms, it's going to have a very low yield. And we still have seen most insurance companies cover the first test, but some insurance companies are saying we're going to give you one test a year, especially if you're asymptomatic. And so that's one of my concerns, is how the expense will trickle down to folks if they're low risk. They have no known exposure. They've been, taking excellent care of quarantining, and to do a screening test. It's concerning that we're going to be spending a ton of money, resources, and using up tests that are not very likely to be positive. And right now we have plenty of tests, but back in the beginning we didn't have as much access. Now we have more, and LabCorp has provided a different medium, a different way of testing, which is saving the reagents as well as all the testing supplies. So I think we're in better shape with our ability to test, for sure. And then again, the concern is just making sure it gets paid for folks.
Right, and I've read in the paper today about how widely various the pricing is.
Yes.
on these tests right now. So if you are in a situation where you have somebody who says one test a year and you feel like you do need another one, it's probably worth investigating what that might cost you.
Yeah, definitely. I think that's something that we don't want to ignore. And there was a theory that with the CARES Act, it would be covered, but how much it is covered and what, different offices are billing, that is, a complicated situation for sure.
Right. I do know that many of the assisted living facilities are looking at more frequent testing for their staff, and that seems to make a lot of sense, since the major situation for transmission is when you're around somebody. And I know that the early reports were a lot of these experiences with infection rates were among families, which makes a lot of sense. And of course, I live with my not of course, but I do live with my kids, and so their activities are going to affect my exposure, and that's an important thing to remember.
Oh, absolutely. I think, masks are of huge benefit. I think that we can't actually overstate how important those masks are, because we're learning more and more about the spread. And right now, and again, all of this is up to change, as we learn more, but it looks like a lot more of that spread is between interpersonal contact with respiratory droplets is the primary way that this virus is spread, much more than what we call fomite spread or surface spread. So while we say do not touch your eyes, your nose, your mouth, wearing that mask, especially when you're conversing with people, will greatly capture most of those small and large respiratory droplets. The concern about aerosolized particles, which are really much smaller, is still present, but not as big as this respiratory droplet of talking with people. So talking loudly, singing, close personal contact. So those masks make a huge difference, which is why so many countries in Asia where this started have not seen the outbreak that we've had, because they very much wear those masks out of, not even a concern for themselves, but as an expression of concern for others, as a way of saying, hey, we're wearing masks to protect you. And so by making that a community standard, they've been much more successful than we have.
I'll note that the Bainbridge Island City Council recently passed a advisory strongly encouraging people to wear masks in public. And when we say public, we're mostly meaning, I think, not when you're alone on the beach exercising or walking, but if you're in the vicinity of other people. And obviously this is a sliding scale, but if you're not able to maintain 6-foot distance, or if you're going to be shopping in a grocery store with a lot of different people, all of those are situations where more protection is better. And I know that at the senior center, as we start to open up for some activities, we're going to be requiring masks for sure.
Yeah, I think that's wonderful. And I think there's a lot that can be done as we understand more about the way that the respiratory droplets are in the air. And I know you were talking about some of the different things you're looking at doing, at the senior center, and people want to go get haircuts and get some nail care done. Keeping that distance, which you can easily do with, say, nails, for example, right? More so than hair. Wearing those masks and having ventilation. So having windows open, doors open, so that air moves. It's stagnant air that's the problem, because it gets suspended. So and that's why we think outside is so much safer. There's so much air around, it just gets dispersed and you don't get the viral load necessary to cause the infection. Same thing if you're enclosed and you're wanting to spend time with family or friends, or have a service provided for you. Leaving a door open, the window open. Thank goodness we're into summertime now and the weather's getting better. But having airflow is key.
Great. If anybody has a question, feel free to just open up your microphone, and I'll see that, and you can go ahead and ask it. Are you back to doing normal, regular doctor's appointments?
Yep, we're back to full care. We have some people that are either very, very nervous or are so high risk they prefer to do virtual visits, but most of our visits now are back to being in the office. We screen everybody for temperature and symptoms when they come, and we have anybody with any potential symptom we see outside. And then, of course, all the disinfecting protocol. Excuse me, and everybody's wearing masks all the time. Mm-hmm. So we're back to kind of back to a regular practice modality. We're seeing a lot of people, ourselves included. We're not so backed up because of the way our practice is, but a lot of our referral base are completely backed up because there was such a delay in care. The oncologists, there's been some delay in diagnoses. So we really want to encourage people to make sure that you're going and getting the care you need. We don't want to delay anything that we can do to, protect people.
And did we learn anything about sort of the advantages of telemedicine in this experience?
Oh, wonderful. It's just like this opportunity. I think it's amazing. I hope that it's here to stay. I hope that it's something that we can use when it's necessary for folks. I think it's a beautiful way. With with doctoring, oftentimes you need to be in person with somebody. You need to touch them, feel them, listen to them. There's a certain thing that you can't get online, but there certainly are a ton of things we can do with it. So I think it's amazing. I hope that bringing it in this manner, we're able to create some legislatures that we can keep doing it. It's not been that we haven't wanted to do it. It's been that it's been restricted for different policies. But yeah, I think it's a beautiful thing.
Great. Madeline, did you have a question?
My question was about tracing. I noticed, like you said, that there are more cases showing up recently in Kitsap and a lot of places. So one of the phase requirements was to do contact tracing. And how do we do that here in Kitsap?
I think that's certainly one of the keys, because when the virus is at the level that it is, I don't think anybody expects us to not have cases and to stop it, to contain it. Right now, we're certainly in mitigation. So the key thing is being able to do contact tracing. And I think they're really trying to gear that up with education and hiring in public health. There was a delay in doing that a little bit when we were closed down, because people weren't working. The staff at the Department of Health and Public Health were really way low. And this is something we need to be able to do to train people and get people hired. So I think that they're working on it. I think Washington State has done a really pretty good job. We had at our office, the Department of Health calls us whenever we've had a positive. Even with screening people, we've gotten them calling us and asking why we've chosen one screening method versus another. So I will say that we have seen really good. I mean, they're reaching out to the doctor's offices. They're the ones who are in charge of doing that. So, and folks are being very responsible when they do have it. So I think we're making progress, but I think we're going to need to create for the future a really comprehensive system to do this and do it well and do it correctly.
So it's being handled by the Kitsap Health Department.
Yes.
And they are the ones that we actually had a brush with this at the beginning of the transmission. There was a person who was here at table tennis whose wife later tested positive.
Yeah.
And what we're doing at the senior center, and what you should check with any place that you're involved with, is keeping track of who is present, so that if there is a situation where somebody comes down positive, we can at least notify other people that might have been exposed to that positive case. And then they can either recognize whether they are self-quarantining, or they can certainly talk to their doctor if they start to experience symptoms.
Exactly. Yeah, that's a great idea. So anything we can all do to help, but this just takes community effort. Everybody kind of being aware and participating. But yeah, I agree. That's a great idea.
So, for example, if you're going to a church service, you might just let them know, ask if they're keeping track of who's there, or what other kinds of activities are we starting to see? Well, we're going to have a little exercise class outside here at the center. So we're just trying to keep track of who happens to show up where, so that we could pretty easily tell everybody else who was there. And that would be true for other activities that you might be participating in.
Yep, that's a great idea.
Any other questions for Dr. Maddie? Thank you, Madeline. You did say that one of the biggest ways that we are seeing this transmission continue is narrowing down on the idea of through breath, through air.
Respiratory droplets. Yeah, breath, breathing, talking. Yeah,
singing. So apparently singing.
Talking, yes, talking loudly. Yes, when you're sitting with somebody face to face or in close proximity. That's where the masks are so beneficial.
Okay, so so if you are trying to avoid exposure, obviously using a mask or asking somebody else to use a mask is a good idea. And then, are there situations that we should, as seniors, look to avoid or be particularly careful about right now?
Yeah, I think being what we know about the way that this disease is manifest in seniors, I would remain vigilant and being very cautious and avoiding situations where you cannot physically distance yourself. Like restaurants, bars that are closed indoors, I would continue to avoid those, absolutely. Make sure if you're going to go get your hair, cut, or you're going to get some other service provided, that they're aware and they have a system in place, like I said, with the windows being open, and feel free to say, hey, can we open up a door and let some air flow in? People may not be aware of how important that is and what that does provide for air circulation. But yeah, I think that it's still a time to be very, very cautious for the senior and any high risk person, that has heart disease, diabetes, hypertension, immune deficiencies, or other immunologic problems. So I think it's avoiding crowded indoor situations, but going to the grocery store, people are moving around, the doors are opening, they're actually quite safe. What we know is you have to be in close proximity for about 15 minutes with somebody that's sick for you to catch that disease. Now, granted, if you have a super spreader and and they cough in your face, no, that could be a high risk situation. But going through the grocery store with a mask on, and then washing your hands and taking all those precautions is really good. But I would say, again, it's those indoor high density places where you cannot avoid being in close proximity. But now, I think now that the weather's looking to be better, being outside, spending time with family and friends at a distance, I think is really important, and really important for our mental health, social health. But there's so many things we can do to make that safer.
Great. Thank you very much. Very informative. We really appreciate you taking the time.
Great. My pleasure, you guys.